Welcome to Public Forum, a community outreach program produced by North Idaho College located on Lake Coeur d'Alene. Featuring guests from around the globe addressing a wide variety of subjects, Public Forum serves to educate and enlighten. Please join host and moderator, political scientist Tony Stewart, in welcoming today's guests.
I'm pleased to welcome you to our program today, and our guest is Jean Plastino Wood. She'll be with us this week and again next week. And we're very fortunate to have her here to speak to a topic that, in fact, we've never done on our program before. As we're in our 29th year, we still find topics that we've never addressed, and that's one thing that's exciting about doing our program. We're going to discuss reduction of tension in human beings through massage and spa treatments. And today's part one, and next week we hope you'll be back for part two. Jean, welcome to the program. It's a pleasure having you here. And I should tell our audience that you are the Director of Education for the American Institute of Clinical Massage, and that you are located in North Idaho. And welcome to our program. We are so pleased to have you here.
Thank you both for inviting me.
And as always, I'm pleased to have regular panelist Janelle Burke, who's an attorney in the state of Idaho. And this is our tradition. Janelle will commence today's questioning.
Well, thank you, Tony, and welcome. We want to talk a little bit about massage, and perhaps many of us don't know exactly what we're talking about. Can you tell us, what is massage? How do you define massage?
The definition of massage isn't anywhere near as glamorous as what it actually is. They call it the manual manipulation of soft tissue or fascia. What that is the hands-on moving and warming the tissues manually, just with our hands. We move the fluids around and break up scar adhesions and that sort of thing.
So you do this, and you have some training to do it. You know where to do it or how to do it. I would take that would be the case. So how do you do this?
In the state of Idaho, there isn't a format for massage therapy or a licensing procedure. Our school is a Washington State program. Massage in Washington State is through the healthcare department. So there's a very strict outline as far as what's expected to get a massage therapy license. In that, the student has college-level anatomy, physiology, kinesiology, musculoskeletal anatomy, and about 300, 400 hours on different technique, theory, and practice. And so the program here in Idaho, we have an Idaho section and also a Washington section. The 150 hours, the first part of the program, is learning about massage, the contraindications to doing massage, because you can hurt people with massage, the endangerment areas on the body where you want to stay out of for furthering condition, and also the effects of the strokes on the body. Those you learn in the 150 hours, and then the additional 650 hours you learn what is necessary to receive your Washington State license to sit and test for that.
So I take it if I'm going to go to a massage therapist, I want to know that I've gone to someone who's had some good official training.
Absolutely. That's important.
And are there different kinds of massages? That is, would you go to a massage therapist for different kinds of things?
Yes. There's relaxation massage, which is the one everybody's the most familiar with. Then there's a rehabilitative section that is just now coming into play more and more. Rehabilitative in the sense that sports injuries, chronic repetitive stress injuries, that sort of thing are being affected now with massage therapy. Stress reduction and relaxation, that's another type of massage. Those are the two areas.
I want to go a little bit back into what I introduced, that you were the Director of Education for the American Institute of Clinical Massage, so that our viewers know that this is professional and it's clinical in that sense of the word. Would you share a little bit about the licensing process? And I know in the state of Washington it's different from Idaho, and that you also have a school and that you're training and people have to become licensed. So if you'd share some of those requirements with our viewers.
At our school, the Washington requirement is that you must graduate from at least a 550-hour program. Ours is an 800-hour program. after you complete that process, you can go and sit for the Washington State exam. And when you pass the Washington exam, that also qualifies you for a national certificate. Idaho does not have anything whatsoever that, in fact, Idaho doesn't recognize massage as a profession as of right now. It goes under the heading of adult entertainment and bathhouse operations, which has really, we're fighting that. We border one of the most respected states in the country when it comes to massage therapy and the licensing procedures. So we're trying to ease that into Idaho. I think that will change because there are more and more licensed therapists coming into our area, living here. So the students are required to put in 150 hours on the public before they graduate. So we have an open public clinic where individuals can come in and receive a massage from the students at a very discounted rate so that they get the hands-on practice.
I want to make that distinction because this is something very important to us, that it's very professional, and that and we're going to get in on the issues of, if not all today, next week's program, about how this helps individuals. I had introduced the program as a reduction of tension, but you, in answering Janelle's questions, indicated, of course, that there are a lot of different aspects to it. But because that is becoming such a challenge in our society, that people work, if not by the clock, longer hours at their job with the other responsibilities they have, and the fast pace we live in, and the technology, and the travel, and the communications, we hear over and over that people have less time for relaxation, less time for just, I guess one would call smelling the roses. So tell us from that perspective, first of all, from some studies that you know about, what is happening, particularly to the American people, concerning their pace of life, and what that's doing to them, both mentally and physically.
It's amazing how in 7 days we have a difficult time taking 1 hour to relax, and that should give us some type of clue as to our lifestyles not being, we're not made to live like we're doing. There is a lot of speculation about massage therapy. The facts are, we know that it lowers blood pressure immediately. The minute somebody puts their hands on you, you start to calm down. We know that it increases circulation, both vascularly, your blood, moving blood through the tissues. That's oxygenated blood, warms the tissues, gives the muscle a chance to relax. But also lymphatically, which is our immune system. So it's moving those fluids as well. We know that it lowers the cortisol levels in our blood, which is the stress hormone levels that we're full of right now. You know, being on this broadcast, our levels have gone up. And so those are the things that we know for sure. There are studies being done continuously at the Miami School of Medicine in the pediatrics division. It's called the Touch Research Institute. Studies are being done all the time on the actual effects of massage. But we know that with a good intent of calming a person down, of easing pain, of increasing their circulation, it is effective, and it's not going to go out of fashion. Here in the United States, we touch less than, we are second to Great Britain, and that has changed now. We've even beat them. We don't touch any more than they do.
They're famous for, historically speaking, culturally not doing that. Compare that or contrast that with, and I know you are also Italian. The Italian culture is very different, isn't it? And, can you, from the studies that you've known, that relates to your work, in a society like Italy, where people are very affectionate, what kind of difference did you see from the British or us?
There has actually been studies done on this also, and in the more Mediterranean cultures, they suffer less heart attacks, cancer, and a lot of that is attributed to the diet. You hear a lot about that. There was actually a study done here in the United States by medical doctors. This wasn't holistic or naturopath physicians. They wanted to find out the location in the United States with the least amount of heart disease. and it was in Esposito, California. And they went there, and they noticed it was predominantly Italian and Mexican. There were no health food stores. There weren't any articles in the paper on health. People ate rich, drank wine. It was just a contradiction to everything that we had learned. But what they did see was very family-orientated, very warm, communicative. They weren't out there just working all the time. They were together. My husband holds my hands down when I talk, and I almost can't speak when he holds my hands down. Everything is just with your hands, and you touch each other and go by. Touch expresses your intent, and you know when a person comes up and puts their hands on you where that person's coming from. You might not pay attention to it or listen to it because you haven't exactly been told, listen to what you feel when somebody puts their hands on you, but it's extremely acute. You know exactly what a person's thinking when they put their hands on you and their intention for you, if they're angry or anything like that. So the Italians, I call it full body contact. From a child, they grab you by the cheeks, they rock you, they love you, and you always know that that's what that's given with, what intent that's given with.
And just another footnote, go back to Janelle, and of course we know that there's improper touch too, and so
there is, and that's a study that I'm hoping will go through. We're waiting for the okay from a couple of school districts. I believe that from a child, children have such awareness about what's going on around them. They know instinctively when a person puts their hands on them if there's something funny about that touch, or if they like it, if that's a good, warm, secure feeling. We tend to be leaning now towards taking all touch away from children because we're afraid of inappropriate touch, when the truth is there's far more healthy touch in our society than there is negative, but we don't focus on the healthy touch. The moms that hug their kids before they go to school, the hand holding, all of that. There's a lot of good touch. If we take away the touch out of the school system, from a teacher putting their hand on your child's shoulder, I think we're going to be making a terrible mistake. They don't have an opportunity to exercise that intuition, and they will get touched because it feels good to be touched. What they need is exercise in discerning healthy touch from negative touch. So,
thank you, Janelle Burt.
We're talking about massage, and I want to go back in time a little bit. Is this something that's a very old skill?
Very old, ancient.
Can you tell us something about the history of massage?
Well, the history, as far as the records go back, they go back in the beginning of Egypt, Africa. There's the paintings on the wall of different spa treatments, the herbs that are used, and that's what's coming back into fashion now, are a lot of these ancient traditions of massage therapy and the hydrotherapy that they use in the spa arena. They know that the ancients always knew the effects of touch. The absorption also of the skin is higher than we ever anticipated, but yet we have all types of creams that doctors prescribe for us to put on now, and it just really never occurs to us the absorption rate. The ancient people knew to put the oils on the skin, to rehydrate the skin and all of that, but it goes as far back as when they were writing, when they were painting.
So it goes very far back, and it's very universal, you're telling me as well.
It is.
That it's practiced in all countries. Is that true?
That is true. Maybe not in Great Britain.
but in most countries.
Yes.
In dealing with this also, let's talk about, you've talked about how it affects blood pressure and all these other things, but let's talk about some of the techniques. Again, I'm going to say for next week some of the issues of senior citizens and youth and all of those kind of things, but let's talk about the mechanics of massage. can you take us through some of the misconceptions there too? You know, you see these photographs where people are having massages that are different than others. Talk about some of the points that like in dealing with the shoulders and the back and so forth, or the neck. There's a lot of tension that develops in the neck. Based on your expertise as a teacher of the school, a person being trained to do this kind of work, what do you teach them about points and how they bring about relaxation and trying to remove tense spots, so forth?
The students learn both through the strokes, but also through the anatomy of the muscles. Different strokes, some knead the tissues, some milk the tissues of a lot of the chemistry that gets lodged in there. The attachment points of the muscles to the skull or out on the shoulder, those have trigger points, they're called. It's congested area. And oftentimes if you use your body with the same motion, repetitive motion, it will spasm on you. It's from overuse. And you can also say repetitive non-motion, looking at your paperwork at your desk and having your head down all the time in one position will start to make these muscles spasm and pull, contract. When that happens, there are points throughout that muscle with just pressure, just pressure. And we know instinctively, when you watch people, you'll see them grab their neck and put pressure. You'll see them grab their arms and do massage, not ever knowing about massage. They do the correct thing. The body just screams out for it. But there are pressure points at the base of the skull, down the neck. They follow the muscle pattern. So that's throughout the body. So the students learn how to both do pressure point therapy, but basic Swedish massage, it's called, where each stroke has a different effect on the tissues.
So are you talking a lot of, as you're teaching this process, there's a lot of different types of strokes?
There is. There's 5 in the Swedish, and some elongate the tissue. They're long, slow strokes that stretch out that spasmed muscle tissue. Others, like I said, pick it up and knead it. Others are a deep friction stroke, it's called, where you take the overlying tissues down, press them down onto the underlying tissues and break up a lot of scar and adhesions. And then there's the calming down strokes, just the long gliding strokes over the body. They follow the contours of the body. Those immediately start to calm down the nervous system. And then you have the pounding and the beating and the hacking. Those you see oftentimes on the James Bond movies, and they scare you to death. You think, that's a massage and I don't want one. And those have a application all to themselves. And
what's different about those?
Those bring the blood to the surface immediately. They call induced hyperemia. They bring the blood up, and that relaxes the muscle tissues by bringing that up. It also sedates the nervous system after a prolonged.
Another thing, some of your students, after they've had a number of hours of training, they come to North Idaho College from time to time, and at midterm and finals, it's very good timing. I think the student government's been involved in having that happen, because students get very tense around midterm and again finals. That's times in your life that's much more stressful, and so it's been a nice way of the Associated Student Government of providing that for students to have 15, 20 minutes to relax. And I've gone over a couple of times with your students and had a massage. And working on the back, when I've had a very stressful time, as they're doing the massage, they'll get to certain spots and they'll be very sore. And I'll say to them, and the expert's saying, you have discovered one of my tension spots, haven't you? So what I'm asking is, even though you've not been holding your head down or you're not at a computer, whatever, as you get tense, does it start locating in some particular key points within your system?
Yeah, and that's different for everyone.
Is that right?
Everybody has their area. It could be in your neck and back, but it can also be in your stomach. And it's not to say that they would massage your stomach, but if you tend to tighten those abdominal muscles, and you get massage, and you just overall start to relax. You let go of a lot of that tension, so you'll feel relief in the abdomen, even though they're doing these long strokes up and down your back. Everybody has a different place for those.
So when you're learning to relax from like the shoulders and the back and neck being massaged, but if you have tension set in your stomach, once you relax, it even helps areas of the body that are not being massaged.
Mm-hmm. Yeah, and then there's direct. There's also abdominal massage. About that ability to feel those trigger points in a person's body and back, I like to let everybody remember when they reach into their pockets to make a phone call and they're trying to find a quarter, and they push past the button and they push past the lint and the dime and they pull out a quarter. You do that with the senses that are on those fingers. You know they're trained very well. A massage therapist, a part of their training is doing massage blindfolded with their eyes shut, just feeling what's in there, and everything has a different feel to it. Scar tissue does, a muscle spasm does, and so they're just looking at your back with your hands, and they can get there, and it's just quarter size, and they can feel it immediately, and they can also feel it go away with that.
As you're training them with these different ways of discovering whatever the situation is, I notice you have charts and so forth. They have to learn a lot about the body, don't they? Just like, obviously they're not trained in medicine like a medical doctor, even a nurse, but they have to learn a lot of the anatomy. Is that not correct?
It's true. They have 140 hours of anatomy minus a lab. We don't have a lab other than the cadaver labs at WSU. We go down to those. But they learn that. They also learn the muscles individually, all of them, origin, insertion, action of the muscle. They learn the antagonistic muscles, the muscles that do the opposite. They learn the synergistic muscles, the muscles that do the same. They learn the nerves that fire those muscles. So if there are nerves that are impinged with spasm muscles, they can follow that route and help loosen up the muscles that are doing that. They know the bones and all the markings on the bones where the muscles insert. So it's quite a detailed program.
Thank you, Janelle Burt.
You've talked a little bit about massage, but you've also mentioned the spa. And can you put those two in relationship?
Yes. The spa therapies are becoming very popular once again because of this ancient that we were talking about, the ancient world. They didn't have anything but the elements, and the elements were perfect. They would go down to the ocean and scrub their bodies down with sand. Well, that's an exfoliation. So now what we do, we have exfoliations in the spas, and we do them with sea salt. And what an exfoliation does is take off all the dead skin cells. And it also stimulates the growth of the new cells underneath. That's a spa treatment. They did it at the ocean, and we do it in Post Falls, and it's very healthy, feeds the tissue, stimulates the tissue. Many cultures put mud on themselves. You'd think that's dirty, but actually mud is so full of minerals, and the skin actually absorbs a certain amount of the minerals that are in that component, whether it's mud or clay. We have many different kinds at the school. So it's an external vitamin. It feeds the skin. And the herbal wraps are soaking in almost like a tea, an herbal tea. And once again, the herbs they dilate the blood vessels and they pull out a lot of the toxins. So one pulls out toxins, one absorbs minerals, and one takes off the dead skin. And those are all treatments that have been done in Europe since the beginning of time. And we're using them again now. They're healthy.
We're talking about people who are feeling good who go to a spa, except that perhaps they're a bit stressed. Or maybe they don't even know they're a bit stressed, and they want to go to a massage or to a spa. But let's talk a little bit about why it is that healthy people would go there. That's the first part of my question. And the second part of my question is, What happens when you get someone that you realize has a greater problem than what you're able to deal with?
Massage is not a cure-all. We have our area, and our area is soft tissue work. We cannot diagnose, and the work that we do, other than stress reduction, which is just a relaxation massage, we do under a doctor's prescription. If you have an adjustment that needs to be made with bone, that's not our area. If you have any neurological problems, that's also not our area. But if you have a problem in either of those areas, you have a vertebra that's pulled out of place because of a muscle spasm, or a nerve that's impinged because of a muscle spasm, we can work that muscle. If you're a healthy person, you have the same amount of every day. You get up in the morning, you go to work, you come home, you're still operating. And none of us really take all the time to move in every direction, to stretch every morning, to do all those things that are absolutely wonderful for our bodies. So to come in and have the circulation improved, to have things moved around our system, that's good for everybody. To have our blood pressure lowered, that's always a plus.
And you feel very good when you leave after having had that massage.
You know, some people do. Some people feel nauseous. If you've never had a massage before, and all of this chemistry is being moved around your system, it can make you a little bit flu-like you have the flu.
And how long does that last? I mean, do you have that every time you go? And how often do you go to massage?
You know what we're going to do is answer that question next week. What a wonderful carrot for our audience. When we come back next week, don't forget, we'll start with that question. And again, Jean, thank you so much for being with us. We appreciate it very much. And ladies and gentlemen, I have indicated that she will be back next week on part 2 of dealing with reduction of tension through massage and spa treatments. And I know that you join with us in saying that this has been informative to you. And as always, we are very pleased to bring you programs on a lot of different subjects. And we shall continue this subject next week in part 2 of this 2-part series. Again, I hope you'll be with us. Until then, please have a good week. I am Tony Stewart.
Recorded on the campus of North Idaho College, Public Forum is the longest-running entirely college-produced program on PBS. Each episode is pre-recorded live and is an educational outreach from North Idaho College. Please join us again at this same time next week for another edition of Public Forum on this public television station. Welcome to Public Forum, a community outreach program produced by North Idaho College located on Lake Coeur d'Alene. Featuring guests from around the globe addressing a wide variety of subjects, Public Forum serves to educate and enlighten. Please join host and moderator, political scientist Tony Stewart, in welcoming today's guests.
We're most pleased to welcome you back to part 2 of a 2-week series addressing reduction of tension through massage and spa treatments. We're very pleased to welcome back to the program Jean Plastino-Wood. She was with us last week, and we're so glad she's back. It was most interesting, and we're going to continue that conversation. She is the Director of Education for the American Institute of Clinical Massage. Jean, welcome back to the program. It was so interesting, and we didn't get through, and we're fortunate that you could be back with us today.
Thank you.
And as always, I'm pleased to have our regular panelist, Janelle Burke, who's an attorney in the state of Idaho. And she was getting ready to ask you a question when we went off the air, and we promised our viewers we'd start with that question today, and so we shall now recognize Janelle Burke.
Thank you, Tony. We were talking about the frequency of massage treatments. when we last concluded the program. And so I'd like to talk about the frequency of massage treatments. And then I'd like for you to, if you would please, walk our viewers through a typical massage treatment. So can we start with, how often would you go to massage?
Ideally once a week. Once a week, you can't get too much massage except in the same day if you were there. We have our massage, we call us massage hogs, and I say us because I'm one of those who never wants to, I don't want it to stop. I could get a massage all day long, but once a week ideally. The process is you call up for an appointment. The appointments are 50 minutes long, and they're on the hour. When you come into the clinic, you're greeted by a student, by handshake. Always the first thing would be by touch and a handshake, and you're escorted back into a private room. And once in the room, the student asks you, we call them our crimp questions. These are conditions that we need to key into if you should have any of these. It'd be a concern. One would be any treated malignancies such as skin cancer. Another would be circulatory problems, any strokes, heart problems, that sort of thing. Recent injuries or surgeries. Obviously we would want to stay away from a recent surgery or injury. Inflammatory conditions, phlebitis or inflamed areas, we can move a lot of that inflammation chemistry throughout the system, which we wouldn't want to do. If you were a female, are you pregnant? Could you be pregnant? And any medications that you might be on. Once we go through those questions and rule out any reason that we could not do the massage, then we ask you if you have any questions or concerns. Always if it's your first massage. If not, we go right into it. But if it's your first massage, we want to know a little bit to make you comfortable. Anything, why have you stayed away, from getting a massage? So maybe we could talk about that for a few minutes. And then we direct you to dress down to your comfort level. Always you're under a full sheet and a blanket. And when we work on your back, it's only your back that's exposed and then covered up. When we work on your arms, once again, just the arm is exposed and then covered up. When you get a massage, your blood pressure lowers and you tend to cool off. So the rooms are warm and you're kept warm and always covered.
And then it lasts about 50 minutes.
Mm-hmm.
And people can expect some touching during that period of time and different kinds of strokes. You explained in the last program there are some different kinds of strokes. Could we just very briefly review those different kinds of strokes?
Usually the therapist will start off with, they're called effleurage strokes. They're long gliding strokes, usually down the back. They go along with the contour of the body. They get you used to their touch, and they also can assess the tissues as they're going over your back, those trigger point areas, and they can feel the tightness with doing those. Then they'll determine a plan just with those few strokes on that back, what they're going to do. They'll start maybe doing petrissage, it's called. It's a lifting, kneading, and squeezing of a lot of the muscle tissues to milk out some of that inflammation. And then they go through a series of another 4 strokes to finish the massage.
And people leave, you use a table, I take it?
Yes.
And then people leave when they've finished.
When you're done with your massage, there's lemon water in every room, and you get up slowly and have a glass of water and leave at your leisure. A lot of people feel that they have to have a full body massage, which is what I just described to you on the table. You can come in and just have your feet worked on. This seems to be just a popular treatment. We have a hydrojet that you soak your feet. Your feet are soaking in this herb water, and then a half an hour is spent just massaging the feet and the calves. Wonderful for diabetics with compromised circulatory system. So,
before we did the show, Jean, you and I were talking about different age groups, and that some people in society are in their, like children, for example, often growing up with their parents, there's more nurturing going on and there's more attention to them. Probably of everyone in our society, senior citizens who have lost their spouse have the least contact, oftentimes at home, and are lonely. Would you share with us particularly some things that you shared with me about senior citizens and why that, I believe you said, of all groups, is the most likely not to receive ever massages or would even be interested in that? Would you share with that? And then I believe there's been surveys of why senior citizens have more skepticism.
We conducted a survey at the Institute, and the number one reason seniors didn't want to come in was, first, they were afraid of being hurt. A lot of things that they see with massage out there show people screaming, in pain because of a massage stroke. The second reason was they were aware that their bodies had sags and scars and veins, and they were embarrassed. They felt, third reason, that they had to be nude on a table with maybe something as small as a towel over them, exposed. And they were modest and afraid of being exposed.
And that's not true. They don't have to.
Absolutely not. The Washington laws on draping are extremely watched. They're just very, very strict. And so much so that if you ever breach their contract with us as therapists about keeping a person safe and draped, you'll lose your license. They will revoke your license. And when they do that, they also publicize that to all the licensed therapists in the area, letting them know you breached that contract or you're done. They're very strict. The fourth reason was the one that was just heartbreaking, and that was that they didn't come and get massage because it had been so long since they had any nurturing touch that they didn't want to be reminded of what it was like and not having it in their lives anymore. So they just as soon stay away from it completely. And that was tragic to me to hear that.
I want to move to another subject because a profession that has been so successful in recent years and working with medical doctors, physicians, have been trained physical therapists, and they have very, very many years of training. And for all kinds of injuries, we have a number in our area, of course, of physical therapists. And you who are involved in massage work, you work with physical therapists from time to time too, as you do medical doctors, is that correct?
We do. Because of the licensing procedure in Washington, we're members of the healthcare profession, and we work well. All of us together as a team is just wonderful. In Idaho, we're not considered a profession at all, so we don't have that communication set up between the different physical therapy office and chiropractic offices over here. But we do, we work hand in hand with them on administering stretching exercises, and a physical therapist will evaluate where the shortened tissue is, where a weakened muscle is, and then we can go in and we can work with that and spend a 50-minute treatment with a person just specifically in an area. So we all are working towards the same thing.
And all of you have different areas of specialty. And it reminds me a little bit of hospice when they have patients. Of course, in that case, unfortunately, the patient is terminal, but they meet each week on each patient. They'll have a religious leader and a medical doctor and a nurse and a physical therapist and a speech therapist, and so forth. So in dealing with individuals and their needs, there are different specialties this would be a proper analogy in a way, would it not? Like in the state of Washington, where they can do that.
Absolutely. Not one treatment will work for everyone, but there is something out there that will work for everyone, and it's just finding it. It's just continuing to move them on to what's going to make them well.
Thank you. Janelle.
You answered my earlier question about walking through an experience during a massage appointment very well, and you took us through all the different steps. But we didn't talk about music. I'm a musician, and music is very important, and I think it's a very powerful influence in our lives. What happens when you use music along with the massage?
There's many studies that are being done on tone. I'm not familiar with all the research on that, but I know a couple of things that we use in the school. We only play there's no vocals in any of the music. It's just instrumental. Nature sounds, and specifically waves and ocean, seems to be the most sedating when that is accompanied. When you put the whales and you put the ocean sounds in with the instrumental, it seems to be the most sedating to the nervous system. So we have a variety of about 20 tapes that we play throughout all of our treatments in a month's time, and the clients hear those and they get accustomed to those sounds, and they purchase these tapes a lot of times, and in their most stressful situations on the job, in the car, just throughout the day, they'll put in these tapes and listen to them, and they'll start to calm down immediately. So I don't understand the studies on all of that, but I know that that's effective.
In other words, we're reminded of pleasant sensations.
Yes.
And that's true with the touching, too, as well. And Tony asked you about senior citizens, but massage can be used for people of all ages, including babies. Is that correct?
That's right.
And what do you do with babies? Is that a specialty?
It is a specialty area, and one of our local therapists, Margaret Hildahl, specializes in that area. Pregnancy, perinatal, prenatal, and infant massage, and she is fabulous. We had a little fun with that at the North Idaho Fair. We set up a table, and you watched the children after all the rides and all of the cotton candy, and they were crying and tired. We'd lay them out on the table and just do a little infant massage on them, and they would just, their arms would fall back and their legs would fall back and their head would just, and they'd go to sleep. They'd calm down.
So what you're saying is that might be a useful tool for parents who find themselves exasperated by a child who's crying, or a child who's fussy because they're tired, and it might be a useful tool to have massage.
Absolutely.
Can people who are not trained do that, or do you recommend that children be brought to a therapist?
I believe everybody has this gift to touch, and that yes, now you can learn some specifics on how to deal with your children. And Margaret actually has classes for parents to teach them how to work with their children. So that's an absolute to do that. But no, you don't have to go through a full licensing program in order to do that.
And so the child not only benefits from it on this day, but they're also probably going to benefit from it because they're going to have a healthier vision of themselves because of the touching. Is that what you're saying?
They are. They'll sleep better. They feel that connection with their parent, and that helps them out throughout their day.
On the first program, we mentioned just very briefly that you and others were working with some schools, not yet, but I guess in a conversation mode at this point. Could you share with us that some children who we classify as having some behavior problems, hypertension, or they just simply don't seem to be as easy to deal with, and of course physicians and all understand a lot of this too, and sometimes there's a chemical imbalance, all kind of issues, but can you use this particular profession as it's licensed in the state of Washington to maybe work with schools and with physicians, whomever, to see that can you have some behavior modification possibly, which would make the school system operate better? There's always some children in some schools that are more challenging to keep them doing their studies and not disruptive in class.
Once again, there were studies done on children are now suffering at the same percentage stress-related disorders that were only saved for adults. And now children are at that same level. They have heart disease. They're even having strokes, nervous breakdowns, nervous tension, and a lot of this attention deficit disorders. A lot of these things are, they're studying that possibly these are just stress-related disorders. They're nothing more than that. At this point, all we've had is medication. Then other areas of aggressive adolescence where they act out and they're very aggressive. We know that massage lowers cortisol levels, so now they're looking at massage possibly helping with that. The backpacks alone in this area weigh 55 pounds on an average. Incredible amount. You see the kids hunched over getting these backpacks to their classes. We're hoping, it hasn't been accepted yet. There's a lot of liabilities, a lot of fear about touch. We're hoping with 2 of the school districts in this area, they're considering letting massage therapists come in under the guidance of their counselors and do a study on behavioral modification, aggressive adolescence specifically in the school district. So we would come in. What we're looking at right now is chair massage, like what you have here at the college, and possibly just work on their hands, their shoulders, their arms. Just see what touch does for this behavior.
Another area with you have the school and you do a lot of teaching, and then on graduation, your graduates go out and work in this field. And you indicate on the first show that there's 800 hours involved. How is your school set up to, if Janelle was to become a student and she was to start today, how long could she expect that she would be in the program as far as months is concerned before she would actually be ready for the test and licensing, for example, in the state of Washington?
A 15-month program, and you can take the test the day after you graduate. I actually just had 31 students graduate last night and another class of 22 tonight. And they can go immediately and take their test. It's offered every Saturday, and they're prepared for it. At the time of graduation, they're prepared to sit for that test.
So it is a 15-month program, and they can take the test in Spokane. Is that where?
And here in Coeur d'Alene
they
also
can actually.
now. Yeah.
But it's the test that is under the jurisdiction of the state of Washington.
Yes.
Yes. Janelle Burke.
You indicated as we were talking before the show, and I know we probably don't have much time, but that you indicated that massage can be helpful for sleep. And so would you take us through that, please?
The nervous system, and not being a physician, I don't know all the different things and complications that people have. Just the stress of a daily lifestyle. A lot of times thinking about what we have to accomplish tomorrow before we even finish up today is enough to keep us awake through the night. I know that doctors give sleeping aids for the reason that during the sleeping hours, the rapid eye movement hours, that's the time when tissue repairs. If you've ever stayed up without any sleep and you felt that achiness that went on in your body, that's just it didn't have time to reset itself, to repair itself. Oddly enough, sometimes you'll come in and you'll get a massage and you will feel like you're asleep, but you're not. That has been documented. The chemistry in your body is at that same level as rapid eye movement or REM stage when you're getting a massage as when you are asleep. So they're thinking that tissues can repair even during a massage when you get to that place where you're really relaxing.
Also, I was listening to a national program the other day, and they've been doing some studies about being deprived in sleep, and Americans are in that status. And they particularly found, I guess the exception that might be, for example, people who retired and had more time, but they particularly were finding in the study that teenagers were really being deprived, that at a certain age they need about 9 hours, and a lot of them were getting 6, and it was affecting their performance in school, their relationship with their parents, and in all aspects of their life. So, and Janelle in her question had suggested that if for some reason someone's at least in a temporary situation of not being able to get the amount of sleep they need, you're indicating like the massage process, it doesn't just replace sleep, but it could help if they had that process. Of course, that would mean every day that if they're losing that sleep, they'd have to massage. But would you just elaborate a little bit more upon that about American people, in addition to what you do? Can you give any advice from all of that of, do we need to change our lifestyles in some significant ways?
Yeah, that's so much not my area, but I'm really opinionated in that area. Yes, we need to make a drastic change in how we live our lives. We don't. You know, we're very much locked into how we live, but we're not designed to live the way that we do. Our body works constantly to keep us well. It's combating viruses. You breathe in so many viruses every day, and your body kills them, attacks them, takes care of them before you never knew what went on in a day that your body did. When you go to sleep at night, your heart keeps beating, your blood keeps circulating through no input from you, your body's doing it. We don't take any time, in a way, as corny as it might sound, to thank our body, to do what's right for it by resting. It's not necessarily being firm and bulked up and toned by lifting weights, although there are advantages to the lifting weights on helping our bones be strong and our cardiovascular system. But our idea of health here in the United States never includes rest, and it's a major component. And laughing and enjoying, that smelling the roses, you know. At least laugh in a day and sit and breathe. You know, we don't even breathe properly.
So there's a combination of things. Unfortunately, in some situations, I think in the political world in particular, a lot of civility has been lost. So we need that, and we need to have humor, and we need to rest, and there's really a combination of things that we could address. In relation to that, though, too, I have a friend who her husband gave her for Christmas a massage treatment, and it so affected her. She goes every week now, and she shared with me that she had headaches and they're gone. She says her work performance is really been affected in a very positive way. She's a writer. Can you share from some of the clients that you've had or your students have had, what are some of the testimonies that you're getting about how it's affecting people if they do it on a regular basis?
On a regular basis, the stress reduction is number one. You're retraining yourself to come in and relax. And that's number one. We have a tremendous amount now. I'm so happy, especially after seeing the study of senior citizens. Medicare used to pay for podiatrists to go in and do foot massage when they would take care of their feet. And then Medicare stopped doing that a few years ago. And we are full of senior citizens that come in and just get their feet and their hand rubbed. They sleep better, their circulation is better, their appetite is better. All of those things that are stress related, you know, when it comes to the disease. Skin diseases. We have a lot of psoriasis and eczema patients that have come in. Their skin has benefited from the lotions. We bring in a lot of lotions from Hawaii and try to use products. This is a study in a research department as well as just a spa. We're researching the things that go on in there. So the effects of kukui oil on burns, that sort of thing, and on psoriasis and on eczema. I'm trying to think. We don't get very many children in there, but we always, if a parent brings in their child, it's no charge, and we put them in the same room. And that's starting to be a popular massage treatment. And I'm trying to think of some of the other, there's enhancement massage that we didn't talk about, but athletes, golfers, if they want a couple strokes off their game, if they're getting ready for a race, they come in and we work specifically on the muscles that they're going to be using during that sporting event. And that's also a popular avenue, and they're making a regular use of the massage facility down there to get a better game. So.
I would think that in sports, tennis would be a good example where very good tennis players serving a lot and using certain muscles in that arm, and so those become very tired and tense, and for just so much use if they're doing a lot of tournaments or practice, and so you're assisting in that way.
Yes.
Yeah. On that note, I think we're going to have to bring the program to conclusion, and on behalf of Janelle Burke and our staff, Jean Plastino-Wood, it's been great having you here for 2 weeks, and you've really been most informative, and you've been generous with your time. We appreciate that. And again, a review for our audiences that we've talked about reduction of tension and some other benefits of massage and spa treatments, and again, making a point of how professional you are and that you're licensed in the state of Washington, and that you have 800 hours of training for all your therapists. So again, thank you for being with us.
Thank you both.
Ladies and gentlemen, I hope you've enjoyed this program as much as we've enjoyed bringing it to you, and we are concluding today a 2-part series on the issue of massage and spa treatments. Next week, we will move to yet another subject, and on this program, we do that from every 1, 2, or 3 weeks, and we are always happy to have you with us, and we invite you to be with us again next week at this same time. Until then, please have a good week. I am Tony Stewart.
Recorded on the campus of North Idaho College, Public Forum is the longest-running entirely college-produced program on PBS. Each episode is pre-recorded live and is an educational outreach from North Idaho College. Please join us again at this same time next week for another edition of Public Forum on this public television station.